Hey there, are you suffering from headaches and migraines? Are you looking for relief? Are you having to take pain medications every day just to bear through it? Are you confused about why it's there and you just can't quite seem to find anything that helps you for the long term? Well, I'm going to share with you today the top 7 tips to relieve headaches and migraines. My name is Dr. David Medoff. I'm a specialist physical therapist over at El Paso Manual Physical Therapy, and we see people here all the time that are suffering from headaches and migraines. And just to explain a bit about the difference, that there are some true differences between headaches and migraines. Many people don't know which ones are which, as far as what you're experiencing. Is it a headache or a migraine? A lot of doctors aren't even 100% sure about it. At the end of the day, your head hurts, and there's certain things that tend to make it worse. What we've seen here in the clinic is that it could be related to diet problems, it could be related to hormones, a recent trauma. Obviously, if you got hit in the head somehow, then there's a good reason for your head to hurt. But if you haven't had any of those issues, if your hormones aren't necessarily out of balance, you've had that checked, or you're just not at that point in life where you're going to have that issue, and you feel like your diet's pretty good and you haven't had any head trouble, then it's confusing. You don't know why these headaches and migraines are happening. So there's tons of reasons why. Here in the clinic, we'll look at people's necks and shoulders and nerves within their head and neck area to get to the root of the problem. And what we find is these tips I'm going to share with you are the best places to start fixing your headache and migraine problem at home. So let me go into these 7 tips for you. Tip number 1, make sure that you're hydrated. Get plenty of water. If you aren't already drinking plenty of water, then I double check to see how much you're drinking. And it's possible to Google exactly how much water you need based on your weight and the average temperature outside and how much exercise you might be doing to account for water that you lose from sweat. But generally speaking, you should be drinking about 4 to 5 water bottles per day, like your typical 16 to 20 ounce water bottle. You shouldn't ever feel thirsty necessarily. You should kind of be drinking it throughout the day. You don't have to necessarily sip on it all day long. What I do personally, I'm working with clients from in the morning. I have my lunch break, and then I have clients in the afternoon. So I don't really drink a whole lot of water while I'm with clients. So I'll chug a bunch of water at the beginning of the day, fill up again at lunchtime, and then in the evening after I get home, I'm drinking a bunch of water then. So I mainly have 3 times a day that I'm drinking water, but I do drink a lot of water at those times. It's possible to sip on water throughout the day as well. And don't be misguided by other fluids. It's possible to think, well, I'm drinking coffee, I'm drinking tea or soda or some other beverage, and it may not be hydrating for you. It actually might be dehydrating for you. So you got to be careful that the fluids that you're consuming are truly hydrating. So check with your doctor if you have any questions about that, because it's different for everybody. There are some fluids that are very hydrating, like coconut milk. Milk can be hydrating as well. It just depends on how your body reacts to it though. But I make sure that you check that you're drinking enough water, and if you aren't, start right away. That's a quick, easy fix. The second thing that we ask clients about whenever they see us for a headache or migraine problem is if they're taking any other medications, because many times, even with pain medications, the side effect might be headaches. It's kind of counterintuitive. You think that taking this pain medication would never cause pain, but sometimes it can cause a headache effect in some people. And then also, if you're taking multiple medications, you have a higher chance of getting headaches and migraines as a result of that. So double check the side effects label on your medications and see if that's an issue. And if you're taking pain medication right now, of course, have some plan to get off these pain medications. So you need some sort of natural solution in order to eventually have to not be in a position where you're having to take these pain medications for the long term. Tip number 3 is move frequently. We often find that people that don't have any hormone problems, their diet's good, they're drinking water, they haven't had any recent head trauma, they haven't hit their head in any way, they oftentimes spend a lot of time in front of the computer, either at home or at work or a combination of the two, and they have to sit still, especially like at work, and they're not moving around a lot. Or if they're watching a movie at home, or if you're stuck at home, as some of the times have called for, they're just still for a long period of time. And if you tend to sit with your head kind of forward, or you don't have proper support or posture, then that still sitting for a long period of time can begin to cause problems that contribute to a headache. So make sure that you move frequently, build in some breaks, just stretch, move your shoulders, stretch out, look around, get up and look out the window if you're at work or at home, or take a quick walk. I wouldn't sit for longer than about 30 minutes to an hour. Everybody has different tolerances for how long they can sit still. You got to find out what works best for you. But break up the long-term sitting still in the same position. That will tend to help out your neck and your headache and migraine problem. But break up the long-term sitting still for extended periods of time, because that will tend to begin to help out the headache and migraine problem. Tip number 4, check how much sleep you're getting and check the quality of your sleep. If you don't already own one, I recommend you look into getting something like this, something like a smartwatch, or you can download apps on your phone and you keep it in bed to monitor the quality of your sleep. Because how much sleep and how good a quality the sleep is, there's different cycles to sleep, and getting enough rest is a big deal for headaches and migraines. So look into that. There's different guidelines for different people. I can tell you for me specifically, about 7 to 8 hours is adequate, and I have to go into deep sleep about 3 times during that time period. There's even times where I've gotten only 6 hours of sleep, but I've made my 3 trips into deep sleep and I feel rested. Now, there are times, especially when I first had kids and you just don't get the greatest sleep, or even if you do sleep 8 hours spread out over a day because you're constantly interrupted with kids or something, and you never get into those deep sleep phases, it really messes with the quality of your rest and can begin to affect the headaches and migraines. So check your sleep quality and quantity. That will help you out with headaches and migraines. Tip number 5, I alluded a bit to this, posture. Look at your posture not only when you're sitting, standing, walking around at the computer, but when you're driving as well, when you're having a meal, even when you're sleeping. You got to be aware of the position of your head and shoulders and neck. Generally, your head should sit right on top of your shoulders, not forward or not too far back either. A lot of people think that they're conscious already of their posture, so they try to move their head back to sit up nice and tall. But here in the clinic, we're often having to undo that. We're telling people that your posture's overcorrected. So what you should feel to have good posture is just comfortable. You should feel comfortable. It might be a little bit of work to bring your head back if you're used to having your head forward like this and you're a little bit hunched over. But you need to be fairly comfortable. It shouldn't bother your headache and migraine symptoms to be in that posture. But ultimately, realize that even if you're in the perfect posture, you can't be there for extended periods of time. Our bodies are meant to move. That's why we have joints and muscles, because joints are where bones move and muscles are what control joints. We're designed to move. And if we don't move for extended periods of time, even if you're in the perfect posture, it's going to be harmful for you. So work to be in a good posture, but break up the long-term sitting anyway and make sure that you get some frequent movement. Tip number 6, get regular exercise. Depending on your fitness level right now and what's possible regarding your schedule, it's a good idea to exercise minimum 2 days a week, if you can 3 to 4 days a week or more. Of course, you don't want to overdo it. You need to have a balance of how much you exercise and how much you rest. But getting exercise gets the blood flowing and releases important hormones and other chemicals in our body. That's important for your brain health, your nerve health. So if you haven't been in the routine of exercising regularly, even if it's as simple as going for a walk, riding your bike, or getting on a machine at home, if you can get access to weight type equipment, like going to the gym, or if you have a home gym, doing something to get your blood flowing, working up a sweat. That's how you can measure how effective your exercise was. If you can sweat a little bit and feel like your heart rate's going up, because not everybody sweats enough. So like I sweat easy. I can look at somebody exercising and I start to sweat. Whereas I know other people that can exercise vigorously for half an hour and barely have a drop rolling down their head. So I like to use the sweat as just one factor, but you can definitely feel your heart racing once you start working out more intensely, so you can use that more accurately. But do that regularly throughout the week, and that will help to regulate hormones in your body. It'll help you to sleep better. It tends to improve your posture anyway. You'll tend to eat better as well for most people, and you get thirstier, so you tend to drink water. So exercise really ties all of these issues together to put you on the right path. Now, tip number 7, get with an expert. Somebody like a specialist physical therapist can really expedite this process to pull out from you where you're weakest in your approach towards fixing your headache and migraine problem, and also tell you what to keep doing. Or maybe there's small tweaks, you're on the right path with what you're doing, but it just needs to be done a slightly different way so that you get the best effect from your current approach. There's lots of reasons for headaches and neck migraine problems. A lot of times it's related to neck pain. So here in the clinic, we look at people's neck joints, their nerves, their muscles, their shoulders as well. We'll have to take into account posture. We'll discuss posture in depth. We cover all that really quickly so that you can get the fastest relief possible. I hope these 7 tips were helpful for you. If you want to get more videos about neck and shoulder problems and how they relate to headaches and migraines, because 9 times out of 10 there's a neck and shoulder problem that sets up the headache and migraine issue, hit subscribe on our channel here and hit the bell to get notified every time we release a new video. Also, go to our playlist for neck and shoulder problems, try out the tips, see the advice there, and it should help you in your headache and migraine issue. I hope you have the best day. Bye-bye.